Welcome to the Continuing Education module, How to Ensure Your Program Meets Bottom Line Goals, from Tactical to Strategic Solutions. Our agenda for this module includes some key definitions, an overview of the problem, some sense of the program goals that we're likely to be dealing with, some important concepts to consider, and some strategies for moving from tactical to a strategic focus for your program. And then finally, a summary of key points. Let's start with some key definitions. And our first definition is the word tactical. And we use it quite a bit, and I wanted to define it for you. And tactical tends to be looked at as the activity that is carried out to achieve the greatest immediate value. So that's short-term orientation. So when we are thinking tactically, we're thinking about that greatest immediate value resulting from something that we're doing in a short-term focus. The concept of strategic as an alternative and as compared with tactical is its activity that is carried out to achieve the greatest overall value, which may not be in immediate sense, but it may be something that's coming through a concern over a long period of time. So our ability to look at this issue of tactical versus strategic is really a central issue for the wellness field. We tend to have gotten bogged down in the tactical activity of wellness. We've really, I believe, lost a lot of our strategic direction as to what wellness can potentially achieve for an organization. Now, the problem, as we see it here at the Chapman Institute, is one, that most wellness programs that employers are doing have fairly weak goals. Their goals are not either very expansive or challenging in terms of what a program can accomplish. Also, there tends to be an inadequate funding base for the program. So people have looked at wellness and I think understood that you can do wellness at a very low cost. It's led to the idea that all wellness can be done with minimal funding. So that's led to, I think, a very broad problem in our field that most of our wellness activity is really underfunded. There's inadequate funding to carry out the mission that these programs have been given. I believe that we're largely tactical in our orientation. So as you see wellness activities in employer settings, it's primarily putting on activities and just feeding those activities. It's not really thinking about what you're trying to accomplish in terms of the health of the population or the organization's life and future, or issues that have to do with the economic underpinnings of these programs. I believe that as a parallel to this largely tactical orientation of existing programming, that there's a limited strategic thinking about what the wellness program can do, particularly as it relates to human capital improvement and the issues around what we're doing to enhance our effectiveness as organizations by focusing on the workforce that's providing the various activities that our organization is involved in. Another one of the issues that I believe is part of our problem is that activity tends to be emphasized rather than results. So as we follow through on these weak goals, inadequate funding, largely tactical activity, limited strategic thinking, we tend to get bogged down in activity that emphasizes activity for activity's sake, rather than having a results orientation. I believe that also part of the problem is we've not made very good targeting choices. We just essentially think that if you do a wellness program, of course you'll know what targets to look at. And I think that's led to a lot of poor choice of targets and behavioral targets that these programs have attempted to address. I think part of this also is a somewhat schizophrenic attitude about incentives. So that what has happened and what I see happening is many people have gotten to the point where They've said, well, we want to be careful with incentives, so we want to use small ones, and we'll limit them, and has essentially led to a lot of dead-ended programming that has not produced much in the way of results. So incentives need to be carefully designed. There needs to be a fairly broad range of pay values in the incentive structure itself. We need to have sufficient magnitude to draw in that 80% of the population in a work site setting that's not innately motivated to do wellness. So weak incentives is also part of the problem that I see on the horizon around wellness activities. In addition, there's a strong orientation towards short-term focus. So we're essentially just doing, what do I need to do next month in order to do my program? I'm not really thinking too much about the strategies I'm pursuing or what I'm trying to accomplish long term. So it has led to an overemphasis on the short term. And finally, due to a number of these factors, it's led to fairly weak economic effects. We can, in fact, see some substantial economic effects in the peer review literature around wellness, but that hasn't necessarily been carried forward by many of the employers that are doing wellness in today's work environment. So, in summary, these are some of the main issues that I find on the problem side as we look out across the industry itself and across the employer community. Now, prioritizations of goals, and one of the best things I believe you can do is to formulate strong goals, but also to prioritize those goals to give your programming and your activities more of an opportunity to become strategic. And the first goal that oftentimes shows up in priority is to improve employee health. So I have to have some ways of being able to translate that from an epidemiologic perspective, from a public health perspective, from a population health management perspective. A second goal can be the reduced growth of health-related costs. So I may limit my concern to just my health plan cost, or I may include the other types of health-related costs that employers can experience, which include sick leave absenteeism cost, workers' compensation costs, disability insurance costs, which include short-term and long-term disability, and presenteeism-related costs. So those are reducing the health-related costs of an employee workforce. Our third priority with this prioritization of goals is to reduce health risk. So there I have the issue of which health risk do I select, and what are the interventions to address those particular targets. But that becomes the third in our example of typical program goals. A fourth priority might be to save money for the employer. So I may be looking at how is that likely to happen? How am I going to accomplish that or do that? The fifth priority may be to enhance employee productivity. So again, that may be my sense of what's desired. It may be ordered in some priority, and then I have the issue of exactly what does that mean? What are the metrics that I need to be measuring or looking at? A sixth priority in this typical set of goals would be to satisfy employee needs, and that's more of a satisfaction-related kind of issue that may come from my employees and or my employees' family members that may be taking part in a wellness program. The seventh priority might be to improve recruitment and retention. So recruitment of new employees, retention of existing employees, and that may be part of what I'm attempting to do in my wellness efforts. Eighth might be to change the organizational culture. So that might in fact be one of my lower priority goals, but one that would cause me to ask the question, how am I measuring that organizational culture for wellness? And what is the desired change, and what are the interventions that I'm involved in to make those changes? So just to give us a sense of context as we think about the tactical to strategic challenge, this prioritization of goals often can help us to actually make that switch from more of a tactical to a strategic level. But it does require my prioritization of the goals that my program is organized around. By the way, there's also another continuing education module that you can look at that has to do with methods for how you might prioritize the goals that your program has. So just look for another one of the modules that addresses goals and then objectives as well. Now, important concepts for us to deal with is that over the last decade, there's been a successive move toward what I would call vendorization of programming. So if you go back 20 years, 25, 30 years, you will see a fairly strong ownership on the part of organizations for their wellness programs. What I think has transpired is employers have chosen to allow vendors to have that role of ownership, and that's resulted in what I call the vendorization of our programs. So the program really is perceived by the average employee as the vendor's program, not the employer's program. And that's got, unfortunately, some downsides to it in terms of how that communicates to employees about wellness and their employers' attitudes toward it. There's also an absence of ownership in general, which is across the spectrum here, and particularly where we have multiple health plans and we have health plans that are doing some wellness activities, it tends to lead to this absence of a sense of ownership on the part of the employer. So the employer gives up some of that ownership, therefore loses interest in managing it effectively, resourcing it adequately, and supporting it in ways that are appropriate. Another one of the concepts that I think it's important for us to think about is something that actually was developed by a colleague friend of mine, James Fries at Stanford. And he was one of the first to really talk about the concepts of using interventions of different types to compress morbidity in populations. And the idea is that morbidity is illness and injury. And under normal circumstances, there's a pattern of illness and injury that one experiences. And then as I combine with other people in a population, it produces a pattern of utilization, which translates into healthcare costs. So the idea that there are a number of strategies we can use in wellness. Some are educational strategies, some are behavioral change-based strategies, others are advice and influence type strategies, others are strategies that affect the nature and structure of benefits and follow through in terms of behavioral economic impacts on the population. So we can in fact do a number of different types of interventions that are more in the strategic mode of wellness to actually compress morbidity in populations. And that compression of morbidity just means fewer injuries, fewer illnesses, and less disease, less healthcare utilization, because we've done some things to actually compress morbidity in that working population. Another important concept here is sub-optimization. And within the wellness space, sub-optimization takes place because we get bogged down in the tactical issues of wellness, lose sight of the strategic value of wellness, and then start to be content with very limited effect and very limited activity. So that sub-optimization is a challenge for us in many areas of the human activity, but it's particularly a challenge now in the field of worksite wellness. Another one of the concepts that's important here is human capital improvement. There have been a number of writers and thinkers that have tried to draw this human capital perspective into finer focus for us. And the human capital improvement is basically asking the question, you have financial capital, you have physical capital, you combine that with human capital, that's what produces organizational outcomes and organizational results. So when we're working on human capital improvement, we want to be thinking about how do we enhance the productive capability, the creative capability, the work capability of our human population that are our employees and their family members. So that human capital improvement perspective is something that we want to build and to emphasize in the content of our wellness efforts. Another important concept here is strategic economic imperative, and that's where we basically are saying to a business, wellness actually is a strategic economic imperative. And that just means if you want to succeed as a business, you need to invest in your human capital to the point where you lower, through compression of morbidity and moving away from suboptimal approaches to worker health, you want to be able to increase the economic vitality, strength of the organization, making something a strategic economic imperative. So that imperative concept means it's something I need to do as part of my role as a business owner or as a business manager, and I need to be able to do this long term. So again, these are some of the important concepts that we can look at related to wellness and related to our problem of tactical versus strategic approach to wellness. Another one of the issues that we want to also emphasize here in terms of important concepts is if we are looking at return on investment as a way of looking at the economic value of a wellness program, we also want to look at what's called the value on investment that is produced by that same program. And when we combine the return on investment, which is highly economic oriented and monetary in nature, with the value on investment, which may be things like retention and recruitment, impacts on morale, impacts on employee loyalty, all of those variety of factors and metrics which drive those and reflect those, then when I do that with both VOI and ROI, I'm doing something that management calls a balanced scorecard approach. I'm balancing my scorecard, so I'm not loading up all of my points of reference on the economic side or ignoring the economics and focusing on the non-economic side, but I am, in a sense, balancing my scorecard approach to evaluation and to looking at the utility of something like a worksite or corporate wellness program. So again, these are important concepts that we need to utilize in order to think through how would I help my organization move from a tactical to a strategic perspective around wellness. Now, going from tactical to strategic, there are some things that I can do to set the stage. First of all, I can use the economic argument for wellness. And there's a great deal of epidemiologic evidence that the kinds of risk factors and behavioral risk and clinical risk that exist in working populations actually increase significantly the worker-related costs of that workforce. So I can use the economic argument that I want to do the wellness program to reduce some of those future trends and cost trends that are affecting my organization and the economics of my organization. I also want to broaden the economic base. So if healthcare costs are a concern of mine, I don't want to also leave out sick leave absenteeism expense, workers' compensation expense, and disability insurance expense, or the losses that occur when someone stays at work but has an underlying health problem, and that's what we call presenteeism losses. So I want to broaden the economic base of what my employer is considering as an economic of the population, a portion of what we call the labor costs associated with my organization. So that's another part of moving from tactical to strategic. I also need to emphasize the value of health improvement so that there are side and collateral benefits associated with health improvement that allow people to focus more intently, make better decisions, be more creative, have less less hostility or reactions to each other that make it difficult to manage them. There's a whole series of things that are part of the value of improving the health and well-being of a population. I also want to use that human capital improvement kind of concept. So I want to have that be part of what my management talks about in terms of talking about the human capital. We have lots of things to improve our financial capital. So we do things to do that. We have our physical capital, maybe fleets of automobiles, and we do a lot of preventive management and preventive maintenance around them. We need to do a similar thing as we think about the human capital that is required for our organization to function. We also want to review goals, targets, and interventions and their alignment. So if we don't have a strong set of goals, and we haven't chosen our targets to fit our goals, and we haven't chosen our interventions to attain the targets and change the targets, then we are really doing very, what might be called fuzzy programming. It's programming that's going to look like we're getting a lot done, but we're not going to really do much in the way of producing meaningful results. So I want to review the alignment between those as part of my ability to help an organization go from a tactical kind of focus in their wellness efforts to more of a strategic focus. I also want to advocate a balanced scorecard approach. So I want to be able to talk about return on investment and value on investment combined, so that becomes my balanced scorecard approach to the way in which I look at the utility and the value of this program designed to work on wellness. In addition, I probably want to use premium contribution to fund the program. So if I want to move from a tactical to a strategic perspective, I need to start affecting the way in which my employees pay for their health benefit coverage. The epidemiologic base allows me to justify that. I can actually show you good science to basically move you toward a position where the individual's choices around wellness should in fact impact on how much they are charged for their health plan coverage. And it's using that premium contribution to actually fund the wellness program, taking it out of a budgetary competitive element and actually putting it into part of your approach of funding your health benefits in general. So these are some suggestions for the context around how you might help your organization move away from a largely tactical approach to wellness to helping your organization become more strategic in their focus and their use of a wellness strategy. Now, one of the other ways that you can also do this, in addition to the items we just covered, are for you to be able to use a futurist scenario to help your organization see the tactical versus the strategic. And part of that means that you might pull major stakeholders together. You might provide them with a retreat opportunity to step back and maybe look at this issue of human capital in a different perspective, to use the wellness program as your platform for affecting that long-term human capital development and human capital enhancement. You might brainstorm a 5 years forward scenario. What should our wellness program look like 5 years from now? How do we want that program and that activity to be affecting the quality of the human capital that we have and employ? Another part of this might be the use of a modified Delphi technique to refine this effort, so that I, in fact, give people an opportunity to shape what we brainstorm and how to essentially allow them to vote for various parts of it, so that you end up with something that has a consensus kind of process involved in it, so that people have the opportunity to have both ownership over it, but also some sense of pride in its authorship. and to stretch the group's perspective, to challenge the group going through this process to think out of the box, to think in a way that's creative, or to think in a way that has more competitive advantage for your organization overall. So that would be another kind of part of this futurist scenario activity. And then to potentially take what this group develops and gain some commitment to implement it by the managers that are at the top of the organization. So being able to have that vision that is constructed about how we might go about enhancing the quality and capability of our human capital through a strategic wellness effort, and to help gain a commitment from your senior management to actually move forward with that vision. And then to continue to compare progress, continue to be able to take the vision the group has come up with and use that as a strategic wedge or a strategic lever to help your organization move from that tactical level of wellness activity to a much more strategic position. So, in summary, this is another alternative for you to be able to help your organization move from that tactical perspective to a strategic perspective for programming. Now, you can also use another method that uses a showcasing phenomena, and it's where you look for a really exemplary wellness program, one that has gained perhaps a COOP award for its effectiveness, that in fact is well thought of and comes to mind when we think about best practice programs. And be able to look for a really exemplary program, research its requirements. What are they doing? What does it require of the organization and leadership, budgetary requirements, and so on, and what results they've been able to demonstrate. And if you research that and you then can put it together in terms of selling the value and utility to management, you can use that showcase and basically use that as your catalyst to help people move from a more strategic level kind of programming to a much more strategic level of programming. And you then want to familiarize your organization's leadership with this effort, with this showcase situation. So this would be using a showcase strategy where you are researching it, understanding it, familiarizing your organization with it, then guiding consensus in the development of your own approach. You can basically say to them, here's what they've done now. How should our approach be different and or similar to what they've come up with? So you use the showcase as a catalyst to help guide consensus in the development of your own approach toward wellness. And then you execute on that and refine it. So what you end up doing is using this exceptional showcase to leverage your organization into a different place around the issue of tactical versus strategic approaches to wellness. So let's now summarize some of our key points. First of all, most employer wellness efforts are underfunded and underachieving. So as we look across the horizon, I see more of this than anything else. Many employer wellness programs are stuck in a tactical rather than a strategic mode. Most wellness efforts lack prioritized strategic goals. Most wellness programs emphasize activity over results. Senior management does not have an accurate view of the costs of worker health. That we oftentimes don't take those 5 major economic variables and actually put them together so that management can see them, particularly as a percentage of after-tax profitability. So they aren't looking at the impact of worker choices, worker health on the economics of their own organization. Most employer wellness programs limit their efforts to the least that can be done. So most of what I see in wellness is kind of the minimalist approach. What's the minimal minimal amount we can do. And it isn't necessarily the minimal effective dose. It, in fact, is just the minimal we can get by with. Many employer wellness efforts have vendorized their wellness programs and lack a sense of ownership or purpose in their programming. So they aren't necessarily seeing the ownership issue as important, or the issue around how does this wellness program fit with our overall organizational objectives and where we want to go as an organization and where management wants to take us as an organization. Many employer wellness programs are stuck in a tactical mode. They are just kind of circling the field. If they're an airplane, they're basically just circling around. They're doing the same thing, changing up a little bit, but they're not getting anywhere. If you want to move into a strategic mode for wellness, I believe that you have to make a strong economic case. I think the economic case is what can potentially make wellness more of a strategic endeavor rather than simply a tactical choice that I'm making as an employer. And finally, you can also sometimes move into a strategic mode and help your organization move into that strategic mode for wellness by emphasizing results, by being able to use a human capital improvement perspective, by focusing on a showcase or using that exceptional showcase as your lever or as your catalyst, and or developing a future vision for wellness. So those are all different kinds of ways, in addition to the strong economic case, that you can use to help get your organization off of its tactical position. Now let's look at some key questions. Our first question is, why doesn't senior management perceive wellness in a more favorable light? And I believe that there are a number of reasons why that's the case. First of all, I believe that most of our wellness activity is pretty fuzzy. We just do some things. They're not very tight in terms of our goals, what our targeting strategies are, and what our intervention strategies are, and our metric strategies that are used to evaluate those. I think also there's a major ignorance on the part of senior managers of what the potential is between the tactical approach and the strategic approach. I don't think that they understand that well or have much of a depth of understanding about it. I think they're also enamored of the tactical view and just see it as a minimalistic approach to doing something that employees feel good about, but don't necessarily produce changes in the health improvement or health status of the population or the actual economics of worker health. And I think they're also confused by some of the controversy that's been unfortunate from people who really don't know much about the field, who have gotten into a position of questioning its value by looking in a very biased way about the evidence. So we've seen that also impact on senior management views about wellness and well-being. And I think that we're also faced with the issue that we haven't necessarily improved the basic technology of wellness at a reasonable rate during the last several decades. So we've essentially stayed with HRAs of a certain type and preventive screening of a certain configuration, and we haven't really done much to move that technology to the next level of perhaps smartphone-based incremental survey work, the building and use of online kinds of strategies and online marketing strategies to actually make offers to people about wellness activities, connecting those with benefit structure through incentives. So I don't believe that we have done what we need to do in order to help management feel more confident that these kinds of programs are a business imperative to them. How should wellness staff position their wellness program? And I believe that you want to look at it in both a tactical and strategic manner. I believe also you want to position wellness as a human capital enhancement strategy, so that you want that to be part of what management is considering from a strategic level. You want to use a results-driven model for wellness. So that's the strategy that moves us into productivity and into measurement and into integration and a whole other series of strategies. We want to position it as a balanced scorecard approach with both ROI and VOI. We also want to position our wellness program in the context of a learning system where we're learning how to do it better as we move along. And I think that that also leads us to be able to use more of a metric or analytic strategy behind our programming. The third question we're going to answer is, what concepts would be helpful to use in getting wellness out of a largely tactical perspective? And I think, first of all, the concepts of epidemiology and the relationship between risk factors, behaviors, clinical risk issues, and the occurrence of a need for health care and the need for chronic disease or the occurrence of chronic disease in our populations is probably a good concept for us to be advocating. I think another one would be the relationship between risk and health cost. And there is another CE module that goes more deeply into that particular area of concept. And that's where it's really kind of a subcomponent of epidemiology that is talking about specific health activities and then looking at their economic impact. So that's another one of the concepts that I think would be helpful for us to help people move out of this tactical over-reliance on the tactical value of wellness. And then the compression of morbidity that we mentioned briefly from Jim Fries, that compression of morbidity concept is also a valuable one for us to be working with to help people move out of that tactical level. I believe also we should be talking about holism, meaning that we are whole people, and it's better when we address people in a whole way. I think that leads right into well-being as a way for us to hopefully reposition some of our wellness away from health risk reduction to achieve more of a well-being emphasis. I think another helpful concept is the ROI plus VOI, so using both of those two constructs, the return on investment kind of perspective and the value on investment perspective. And then the ability for us to be metric driven, meaning we can measure what we're attempting to achieve and then modify our approach based on what our experience is. And then finally, to be able to really emphasize the human capital improvement or human capital enhancement effects of these types of programs. So these are some of the concepts that I think would be helpful to your organization in terms of helping them see more of a strategic rationale for wellness and not just the tactical rationale. Now that you completed this module, go ahead and take the test.